Good morning, friends. Myself, Dr. Atul. I am your faculty for injury prevention and rehabilitation. Till now, in the sixth week, we have studied about the sports injuries. How many types are there? The various modifiable and modifiable factors by which we can prevent the injuries. Now we have also studied we have also discussed the types of injury stress reactions also, and now we are discussing about the rehabilitation part of the injuries or sports injuries. So in the rehabilitation we have discussed how the rehabilitation part is designed. That is early mobilization, protective splints or brace. Like a person who is recovering from the ACL tear, and after his operation he is advised to wear fixed braces, fixed knee splints with the angle fixation. Like initially it is up to 60 degree, 30 degree, then it's up to 60 degree of flexion. So accordingly, as per the week progress or as your range of motion progress, that fixation is allowed. So these splint or brace gives you confidence to walk properly and simultaneously activate your proprioceptive organs. So the other part of rehabilitation is strength training. The strength training part begins with the isometric exercises. Isometric exercises, as I told you in my earlier lecture, these are the exercises which you have to you do when there is no body movement but your muscles got activated. Like you are lifting a very heavy weight with the help of your elbow, but that weight is not moved, so your biceps and your entire upper body muscles or your limb muscles got contracted. So these are the example of isometric exercise. Or you are sitting on chair, or you just lift your flexed knee into the knee extension, and your entire thigh muscle got tightened. So this is and you are holding your knee in the extension. That is a type of isometric exercise. And isotonic exercises, when you do with dumbbell curls or hamstring curl or leg push-up, leg press, these are example of the isotonic exercises. And plyometric and proprioceptive exercises are the specialized exercises which you have to do required trampolines or plyometric board or plyometric jump boxes. So these are has to be done under supervisions of the physiotherapist or a qualified doctor. So any injury, you have to start with the isometric exercises. Isometric exercises generally don't overpressure the joint or the affected area in general. Then comes when you achieve the range of motion, and isometric strengthening provide the post surgical muscles enough power so they can bear the isotonic exercises. And then when you achieve in the beginning, you do isometric, then the isotonic, and then the plyometric and proprioceptive exercises. Then the game specific training you have to start. And once with the slow movement to fast movement, and easy skilled movement to difficult skilled movement. And when you are with slowly to the fast, and once you are fully confident, then you will be assessed by a specialized doctor or a physiotherapist or biomechanist. He will judge you on either isokinetic machine or a specialized test like Hop test or Y test, uh, single Hop test, uh, and then they advise you to return to sports. And during this rehabilitation, your psychological training is also very much required. Why psychological training? Because you got injured, you're missing your sports or your career on stock. Sometime there are so many examples with the and nowadays sports field is very cutthroat. Like uh, there are number of fast bowlers are in the line, or a batsman in the line. If some got injured, the other person is performing so well that the injured batsman got re-enrolled or re-entry into the team is very difficult. Like Rishabh Pant, he got accident. Now the entire team, and there is no replacement. He is going to replace that the player. So it is very cutthroat. So this time the psychological part comes, and the sports psychologist uh, uh, boost his psychology and give him a small task by which he remain in good in good mood, or with full zeal and full confidence and full positive attitude. He recover, and with the help of all these things and his skill, he will be again a part of his team. So psychological training during rehabilitation is very much required. Now we will discuss a little bit about the various sports injuries. First, we discuss about the sprain. Sprain is a ligament injury, and ligaments are the bundles of uh, collagens which joins two joints, and they are generally intra synovial or inside the joint capsules. The example are anterior cruciate ligament, posterior cruciate ligament, or deltoid ligament of ankle, or acromioclavicular ligament. So they all are help the joints and stabilize the joints. And the injury of these ligaments are be categorized under various grades, like grade 1, grade 2. Grade 3 generally considered to be complete tear, and grade 1 it's a if the injury is less than 50%. If it is more than 50%, grade 2, or grade 3 it is complete tear. So in the same uh, ACL tear grade 1, chances of healing is there. Grade 2 and still some sort of chances, or with the help of his strengthening of his surrounding muscles like his quadriceps and hamstrings, and his pelvic hip stabilization exercises, or hip joint stability exercises, he can still perform. But with the complete tear, there are some examples when an athlete is congenitally lacking his ACL or anterior cruciate ligament, and he is performing at club level or at the international level. So with the help of his muscle strengthening, these injuries can be overlooked. But if a person is required or he has undergone under some sort of surgery, then he has to undergo complete rehabilitation. Sometime it might take 4 months or 4 to 6 months. In general, ACL recovery required 6 months return to play. If the rehabilitation or rehabilitation was very good, and the surgery was very good and the motivational level of that athlete is extremely high, then he might recover at 4 months of time, but in general it requires 6 months minimum to return to play. And the initial management for any injury is either polish or price. Initially, at the time of injury at the playground, give him a rest, that is provide a splint, or then apply ice, give a compression bandage and elevate that injured body part. And after, if he undergoes knife, that is surgery, then before that he requires rehabilitation, under which first the swelling has to be reduced, his surrounding muscles and that involved joint muscles, the movement, those required for movement muscles, they are responsible for those active movements, will be strengthened up initially with isometric exercises, then the isotonic, and then comes the part of surgery, and after that rehabilitation, as I briefed you under previous lecture. Same strains are the injury of tendons and muscles. Tendon are the end portion of the muscles. It's a thick bundle, and if it and cause attached to the bony prominence. Sometimes the muscle pull was so strong that it avulsed from the bone, or it lead to the avulsion fracture also. And sometimes it just tear up small fibers, that is grade 1, and if it is more than 50 or near about 50, it is grade 2, and it is if the complete tear, like few people might have heard of biceps tendon, that is Popeye biceps, when where the biceps tendon got rupture, and abnormal shape of biceps tendons occurs, or hamstring strain is quite common in sprinters. Tricep tear, pectoralis tear, when doing with excessive weight, sometimes doing bench press with the excessive weight, and body is not properly fit, that sometimes that pectoralis tendon got ruptured, and there is complete blackening of the your chest. And trapezius tear, though it's a very sprain is there, that is grade 1 or grade 2, then my small fibers got injured, or a small spasm is there. And then the same principle of sprain here also we use, that is polish and price. But in the tendon, if it is a complete tear, then surgery is the only treatment of choice, where the surgeon has to give an incision and stitch the distal and proximal portion of the tendon. And in the muscle, if the injury is bigger, then he use persisting sutures, or to resuture the muscles. In the strain, or like in the thigh, or when these injuries occur, when the belly is affected, the loss of blood is quite a lot, so there is a chances of muscle in between the muscle layers hematoma formation. So one has to be extra careful when you feel there is some sprain or some localized tendon. So don't massage, don't do excessive massage, or don't do massage only. It may lead to myositis ossifications also, or increase the blood loss, or that will trigger the fibrosis of that muscles. So these things in general you should not do when you suffered, or one of your athlete suffered with the injuries. So today we will stop here.